Hi, and welcome back to the show, Examining Medicine from Traditional to Alternative and Beyond. I'm your host, Dr. Franchell Hamilton, and we are in the Limelight TV. I'm really excited for our guest today because it's a different take on health and well being, and it's a very timely message with everything that's going on. Today, as our guest, I have Dr. Gabriela Stein. She is a PhD psychology who specializes in child and family psychology. She focuses on how culturally relevant factors affect development and psychopathology in ethnically diverse groups of people. And we will break that down and kind of tell you what that means. She predominantly works with Hispanic, but her and her colleagues have worked with all different types of cultures and ethnic groups. And she looks at how different factors can affect their overall health and well-being. So welcome, Dr. Stein. Thank you for coming on the show.
Thank you so much for having me. I'm excited to be here.
I was really excited about your area of research. And so we kind of did a little bit of an introduction, but if you want to kind of, in layman terms, describe exactly what your research is and what you look at and what you do.
Yeah, so generally my research examines how we understand how families who face sort of discrimination, stress, different ways in which racism may impact sort of the health and well-being of folks, how that gets disrupted by different protective factors that we see that are culturally based, and how families sort of can help navigate this difficult landscape of sort of the different disparities that exist for communities of color and how they can support the well-being of their families and their youth and themselves.
And so you can see how this topic, how discrimination can affect health and well-being, is like timely right now. Obviously, everybody watches the news. There's a lot of different things that are going on, but for somebody to actually research this and research that these outside factors, the disparities, the discrimination, how they actually affect families, so to speak. So give some examples of some of the things that you have researched and have found.
Yeah, so my work has primarily focused on mental health. So we found, for example, that kids who experience discrimination in fifth grade experience greater levels of depressive symptoms and anxiety symptoms way past until they're at the end of high school in 12th grade. So that was a recent study that we did and had published. But the work generally finds that discrimination and racism, which has primarily been studied by individual experiences of discrimination. So folks sort of saying, I feel treated less than other people. People sort of call me racial epithets. People make jokes about my ethnic group or devalue my group. Those are associated with a host of negative health outcomes, including poorer sleep, dysregulated cortisol and stress mechanisms, higher levels of obesity, blood pressure, BMI. So, in terms of health outcomes, that's not the work I've done, but we know that there's some impact there. And it is highly correlated with experiences of depression and anxiety.
I think that's interesting because when I treat my patients, and in general, I try to treat the whole patient. And you bring this new aspect, and I'm African American, obviously, and I haven't even thought about this extra additional aspect that is associated with people, how they experience the world, how they perceive their experiences. And I think it's important for everybody to know that this matters. And clearly it matters in kids. Kids are already experiencing this. So you can imagine by the time I do mostly adult medicine, but by the time I see them as an adult. So you're saying discrimination can actually affect all these aspects of health. So as a physician or a provider, we're treating hypertension, we're treating obesity, we're treating hormone imbalances, anxiety, and depression. And these things can come from their environment, the way they were treated. And that's kind of my whole thing, which is why I wanted you to come on the show, because you bring a different take. Like when I look at environmental factors, I always looked at relationships, work relationships, stuff like that. Even though it is so obvious, I didn't even take discrimination into account. And then you explained that what you saw in kids, which is really sad. So how did you guys discover that? Did you just give them a survey, or and why fifth grade?
Definitely. So we did a survey. This was a survey that was self-reported. The kids sort of asked, told us sort of how they were feeling, what they were experiencing. And this was a larger study that was meant to sort of examine risk and protective factors for substance use, actually, in Latinx, Mexican origin communities in California. So when
Yeah.
they started in fifth grade because they were interested in that trajectory into the transition to middle school and into high school. And when we see the risk for mental health and substance use really increase at that transition point. So a lot of the research on discrimination and its impact on kids has focused in adolescence. And in fact, there was some really cool work that was done by a team of researchers out of Northwestern that sort of found that adolescence is a sensitive period in which increases experiences of discrimination have unique impacts on the stress regulation processes of the body. So some of those things you see into
Really?
adulthood, yeah, they found that even discrimination experience in adolescence was uniquely predictive relative to in early adulthood. And again, this is some newer work that's emerging, but it's important to think around. It makes sense, right? That adolescence is
Yeah.
so much is changing. You're really trying to sort of your brain chemistry, your body chemistry, everything is sort of on high, just changing and quickly, and then your life, right? Like how you're going to sort of
Yeah.
the next point to transitioning into adulthood and to what you're going to do next.
Wow, that is very interesting. And it's interesting and a bit concerning, right?
Mhm.
Because I don't know if this topic is talked about enough, to be honest, which is why I want to bring it more in the limelight, so to speak. And I also have a daughter who's now going through puberty and trying to kind of find her own way. There's so many other things that they have to navigate during this time, especially females. And then to know that this extra area kind of compacts that and actually affects the way they develop is very interesting. I don't know if I've heard a lot of research about this, and I really think that this is important and that all providers need to kind of be able to take this into account. How would you even know that this is affecting them?
Yeah, no, that's a great question. And I actually agree with you. When I was in training for my clinical psych PhD, we didn't talk about how you assess discrimination. We didn't talk about these kinds of things as they impacted mental health because we looked at the other things, like you said, sort of family, work, environment, peers, right? All academics. We looked at lots of other things,
Yes.
but didn't really get trained, at least in my training, in terms of how do you really assess for and understand that experience of discrimination. So for providers out there, there's a lot of measures out there that are free. There's a measure, experiences of discrimination measure, that's been used in public health research. It's sort of the gold standard measure that has been sort of touted by NIH. And it has a couple of different types of questions. So some ways it's looking at individual experiences of discrimination, everyday experiences of discrimination, as well as like some more lifetime kinds of things like getting a loan for a bank, finding housing in your places of
Yeah.
healthcare. So I think providers should just ask, as part of an intake process, sort of what are the stressors you're experiencing, and do you have any race-related stressors,
Yeah.
or any ways in which you feel like you're being treated differently because of your race, your ethnicity, your immigrant status, because sexual orientation, religion, there could be lots of different ways in which it comes about. Although primarily the work has focused on race ethnicity.
Wow, that's amazing. And do you recommend people, because like in adults, we can screen for that, but I feel
Mhm.
like the damage is almost done.
Yes.
And we can talk about that. But what age would you recommend kind of tapping into that? Like as a parent, I
Yeah.
know you have ways to kind of talk about this. So, two questions. What age would you recommend parents or pediatricians or whoever
Mhm.
kind of look into this? And then the second question is, how do parents kind of talk about this?
Yeah, great question. So the first question is we really should start talking about this as early as we can. Kids
Okay.
psychologically start seeing racial ethnic differences by the age of 3, and they by the age of 5 start having some sense of stereotypes that exist out in society and have
Wow.
a sense of what which groups are valued and not valued, and beliefs about those. And I think for a lot of folks when people are asked about this, they worry about the developmental stage. Like, when is a kid ready to talk about these kinds of things, which is a
Yes,
very,
exactly.
yeah, these are hard topics and hard for parents to talk about, hard for kids. So you really want to think about how to do it in a very developmentally sensitive way. But I think ultimately kids have lots of questions, and they come in and they're trying to understand the world around them. And sometimes we're like, oh, we don't talk about that, right? Or you sort of don't talk about it because you don't want to hurt them. But ultimately, they're getting these messages from society around them, from
Yep.
TV, from shows, music, media, the news, right? So having those conversations is important, but you don't want to scare kids. So one of the things you really want to focus on is building a sense of pride, instilling a sense of sort of pride in who they are and their culture, their identity, understanding what that identity means, countering some of those negative stereotypes that might exist for different groups by showing positive sort of role models and highlighting history, doing storytelling. So one way that parents can
Yeah.
easily do this is really just bringing out those sort of joy and resilience that exists in many communities that have been marginalized, but specifically talking with kids about how to deal with if someone calls them a slur, if someone teases them in the playground, if someone says something in class. Just last night, we were having this conversation with my daughter, who is 12 years old, and she was worried about sort of a class discussion that was coming up. Just even think about like when folks start talking about US history, it's very
Yeah.
complicated. So it can come up in lots of ways. I remember my kids' school, in in an effort to be multicultural, asked them to come in. Everyone had to come in and talk about their ancestors and where their families originally immigrated from, right? And for
Yeah.
Black kids, that means, so they're in second grade, and to talk about your immigrant story isn't the same thing in the South. I'm in North Carolina, right? There wasn't, necessarily an immigrant. There wasn't a country you were from, right? There was a history
Yeah.
of enslavement, right? And so that's, a conversation in second grade that this kid is needing to start to have.
Yeah, you're
So
absolutely right. Because my daughter had that same project actually. And our background is French, like where I'm Haitian. And so we came some of that, but then we were trying to do like ancestry DNA, almost the same. It was the same project. And it's like I couldn't find it. Like for my husband's side of family, right? Like, right, we were slaves and we came, and I don't know what African country, that he was from. So it was very interesting. And it was a little like, how do I present this? And how do I tell my second grader that this is, kind of where she comes, some of her roots that she came from? So it's very interesting. And you're right, because I've started seeing it early. I started seeing early, mostly in my daughter. My sons don't have it and I don't know if you've noticed like more of a gender. I don't know if
mhm,
females in general are more sensitive to it, but
mhm,
have noticed like they immediately noticed the popular groups and the not popular groups. And I think this idea about being valued is very important. And I agree, it's important to instill it early, because nowadays, as parents, we're all seeing this stuff earlier than what I felt like we should be seeing it. And I don't know if it's part because of social media or what, but to be honest, even in my household, I really try to monitor what my kids are watching, but you
mhm.
can't like hide them or shield them from everything. I mean, look at the news. Like I had to explain, you know, the death of George Floyd. I didn't let them watch that, but they're talking about it. And now, kind of the stuff that's going on with the Asian community. You know what I'm saying? Like, this is something that they see and that needs to be discussed. So I totally agree with you. And it's shocking to me, although it shouldn't be, that it directly affects their mental health and their overall health, like other aspects of health.
That's
It's
right. That's right.
amazing.
Yeah, so I think pediatricians should definitely assess for some of these sort of what are experiences at school with peers, how is that with teachers, and families should talk around. There's some great book I would recommend folks read, Howard Stevenson's book, that really talks about helping kids develop sort of a coping efficacy, a sense of what to do in these racialized moments and how to sort of deal with that and feel ready to cope with those and feel ready to sort of interact with others. Because one of the other things that happens too is that, sometimes people think these racial kinds of incidents happen with kids that are, racist, quote unquote, but these really happen with kids that their peers might say things that they're like, wait, what? Where did that come from? And it's even
Yeah.
harder because kids are trying to navigate. I want to stay friends with this kid. This kid said something that was a little offensive, and I don't know then how to navigate that relationship. So it becomes complicated for kids because they're wanting to sort of give the benefit of the doubt. The other thing we learned from some of our research too is you also don't want to go to an extreme and just talk about it in a negative way. So the research on the whole, not just our research, but research that has been done generally has found that these balanced messages that focus on pride, that focus on cultural knowledge, focus on learning about the culture, learning about those kinds of things are really important and then coupling those with active conversations about discrimination as well. Those need to have sort of a message around, it's not just, hey, you're going to be discriminated against, but this is what we can do. This is what's important. These are the ways that you can thrive. And it's also important not to have the messages. A lot of times folks give messages like you just have to work twice as hard. You have to do, you have to, to get ahead, which is an important message, right? You want to work hard, but that also leads to the wear and tear physiologically on the body as well. So some research sort of has found that as well, that level of,
Wow.
it gets complicated very quickly in terms of what to do.
Yeah. And so it's great that we have this awareness now, but I'm still like, oh my gosh, like as a parent, like, am I doing the right thing or I'm not doing the right thing? I've always been very like, let's talk about it.
Mm-hmm.
And that's kind of the relationship that I have with my kids. Like, I really want them to be able to come and talk to me about everything. And I'm usually honest at their level, right?
Mm-hmm.
And I try to relate things kind of at that level because the schools, I would say parents can't really depend on the schools to teach that. They teach
Right.
history. And that's where a lot of kids are getting their interactions. And
Mm-hmm.
so I would, and you can agree or not agree, it's really up to the parents and to kind of introduce this idea to them, right?
Yeah, yeah, definitely schools are making some movement. There's some really cool work being done looking at how schools can support socio-emotional learning around diversity and equity. But you're right that ultimately, for right now, it is sort of in the parents sort of, and I think it's really important for parents to really not shy away from the conversation, but to engage in it. And I love how you said honestly, right? Honestly and at their level and focus, I think leaving a sense of resilience, leaving a sense of that they can do something about it, because where it becomes problematic is if it becomes overwhelming and you become hopeless and you don't know what you can do. So having
Yeah.
that. And then the other thing I will say is also connecting with places of resilience or social support. So for example, spaces like church,
Yeah.
community organizations, places in which there's like explicit conversations around sort of any kind of active kind of group that's sort of working on those issues, whether it's like for, the Dreamers or, Asian American
Yeah.
sort of solidarity, that these kinds of groups can also be really useful too.
Yeah, I noticed that because I think it's important for to be awareness like when all this kind of discrimination and racism was going on a lot this past year, people were trying to figure out how to navigate it. Like you had a lot of like Caucasians saying they don't see color, and then you had people on the other side saying you need to be able to see color because you need just to be aware, like and not just because you see color doesn't mean you're racist or you have any hatred. You just need to know that there's distinctions. So what in general would you say for parents or people struggling with this issue? Can you speak on seeing color as not necessarily mean seeing hate, but you do need to be able to recognize that there are differences? What do you think about that concept?
That's exactly right. That's that for a long time that our society felt that the way to deal with racism was to say it's like we don't see race, right? So that's just say like we don't see that part, and that was sort of the response to how to cope with sort of the legacy of slavery and the legacy of racism in our society. But in fact, that negates all of this research that really shows these continued disparities that exist in health and economic outcomes and housing and
Yeah.
you name it. So that's really important for all of us to acknowledge that these disparities exist, right? And that the reason these disparities exist is because of discrimination, racism, and that's the root of it. And so in order for us to root that out, it's not ignoring that it's there, it's
Yeah.
seeing it, acknowledging it, and also bringing, and celebrating the things about sort of the resilience and communities that have shown that, and understanding sort of the unique things that different communities have done to sort of cope with it and be able to bring that forward. So yes, it's really, I think sometimes it's a really easy thing, and it makes it hard, right? When you talk with your kids, you want to say you should see people for people, because everyone's a
Yeah,
human.
exactly.
So these humanist messages are important to say, yes, people are people, but people bring about history, bring about lots of experiences, their cultures, their ways of viewing the world, and acknowledging those, I think, is really important.
Yeah, so I think that's great information. Essentially, as far as our kids go, talk about it early and then be honest, be at their level, and just show resilience and bring a positive light on it. Don't necessarily be like, oh, you're this culture or you're that culture, so this is the way it's going to be. Have them value themselves and be prideful in themselves. I think that's a great kind of summary of what you're saying, how to deal with it in kids. And I think that'll help a lot of parents. And this actually affects mental health, and this affects health as they move on into adulthood. That is very interesting topics. Is there anything for people who are an adult who have manifested some of these anxiety, depression, or other not necessarily healthy outcomes
Mhm.
because of what they experienced as far as racism and discrimination? Is there anything that they can do? Is it too late, or is there stuff that they can work on?
No, and again, this is not, I'm more of a child person, but some of the work, we actually did just a paper recently that I published with one of my students, that we found that in adulthood, the use of what's called shift and persist coping could be really helpful and can mitigate the experiences of discrimination on later depressive symptoms. And basically, what that means using is that
Yeah, like what?
shift.
I'm joking.
What does that mean? So
Yeah,
basically, what we found, right, shift and persist coping is sort of a form of like disengaging. And one of the things that I think is really important is acknowledging the structural aspects of racism that exist and becoming aware of that, sort of developing. And I think this, you can start doing this in adolescence, that these experiences of interpersonal discrimination that you are having are because there's a structural system in place. And that's the structure that we need to change. Um,
yeah,
so what shift and persist really helps to do is sort of take away that interpersonal piece. Like, and so you move out of that cognitively, you sort of say, okay, there's nothing I can do in this situation. And the persist
correct.
piece is having that cope, that life meaning, finding things that give you hope and meaning and optimism about the future. And where we found that that can be particularly helpful, again, through church, through civic engagement, through activism, those things can be really useful in sort of some ways as a way to help do that. Obviously, just normal healthy behaviors that we talk about in terms of adaptive healthy things are going to be useful. But in particular, having a sense of social support around that and a community where you're sort of finding that resilience can be really, really good. But, the
Yeah.
healthy behaviors that you typically would recommend, but that ability to move to like disengage from some of the stressors and move into things that give you meaning and hope can be helpful.
No, I think that was great. That was really good advice. And I think this is a really important topic that honestly is not really discussed much. So I'm glad we were able to kind of sit down and kind of bring this more into the light and discuss that, how this actually affects it. I learned something new here, and I'm sure a lot of the audience has learned something new. Thank you for your research and your continued research in this area. And honestly, I hope this becomes more widespread. I hope it gets to the point where providers are using some type of assessment in their assessments, the pediatricians, even the schools. I mean, that's the goal. So I'm glad you guys started this research. Where do you see your goal? What is your goal of all of this? Just to kind of bring it to light and shed light and learn and to help people to treat it?
That's exactly right. Yes. So my goal is to just have help families having hard conversations, but really thinking about how to engage in this in a way to protect different communities and make sure that folks have access to the support that they need. So also having mental health interventions that are tailored and unique to these needs, and holistic health to support sort of just health in general, because we know mental health and physical health are so tied, right? And so
Yeah.
just having sort of developing sort of a sense of a way that we can sort of live our best best lives and be able to have
Mhm.
that opportunity that all kids and all families have that.
No, thank you. Thank you very much for your work. Where can people find more about your work and what you're doing?
You can find more in our on our lab website, which is caminoslab.org. Okay, CAMINOS lab.org.
Okay, perfect. Well, thank you very much, Dr. Stein, for everything you're doing. Thank you for bringing this topic to us. I think it's very important, and I hope everyone has learned something and now will be more aware on how to deal with these and how it actually affects our kids long term growing up. So,
Yeah,
thank you very much.
no, thank you so much for having me. And on our website, we have a tool for parents that they can use to have navigate these conversations called One Talk at a Time. So you can find more information about that there too.
Okay, that'll be perfect. Thank you. Thank you very much.
Thank you.